Varicose veins are one of the most common vascular pathologies that affect millions of people around the world. It manifests itself in the form of enlarged and sinuous veins, most often on the legs. Varicose veins cause pain, swelling, and discomfort, and if left untreated, can lead to serious complications such as thrombosis, trophic ulcers, and chronic venous insufficiency. Effective treatments for varicose veins include a wide range of techniques, from lifestyle changes to surgical interventions. This article will discuss in detail various powerful remedies for varicose veins, their advantages, disadvantages, and methods of application. Causes of varicose veins. Varicose veins develop due to a malfunction of the valves of the veins, which prevent the reverse flow of blood. Among the main factors contributing to the occurrence of varicose veins are genetic predisposition. If someone in the family suffers from varicose veins, the probability of its occurrence increases. Professions associated with long-standing or sitting. Office workers, hairdressers, and teachers are often susceptible to this disease. Hormonal disorders, pregnancy, hormone therapy, use of contraceptives. Obesity. Overweight increases the load on the legs, which contributes to varicose veins. Sedentary lifestyle. Lack of physical activity disrupts blood circulation. Symptoms of varicose veins. In the early stages, varicose veins may not cause visible symptoms, but over time, the signs become more pronounced. Visual changes of veins. Veins become visible, bulging and bluish. Swelling of the legs, especially after a long day of standing or sitting. Feeling of heaviness in the legs occurs especially in the evening. Pain and cramps, especially at night. Itching and burning in the veins may indicate inflammation of the veins. Conservative methods of treatment of varicose veins. Compression therapy. One of the most powerful and frequently used treatments for varicose veins is compression therapy. Special compression stockings or tights help to improve venous blood flow by reducing pressure on the walls of the veins. The benefits of compression therapy: support for normal blood flow, reduction of swelling and fatigue of the legs, prevention of further progression of varicose veins. However, compression therapy does not completely treat varicose veins. It helps to prevent complications and improve the patient's quality of life, but for a lasting effect, it is necessary to combine this method with other approaches. Medicines. The modern pharmaceutical industry offers a large number of drugs that help to cope with varicose veins. The most effective of them are phlebotomics, drugs that improve vein tone and reduce inflammation. Examples: Detralex venaris Phlebodia 600. Anticoagulants dilute the blood and prevent the formation of blood clots. Examples: heparin, Clexan. Antioxidants promote the restoration of the vascular wall and improve microcirculation. Examples: preparations based on vitamin E and ascorbic acid. The use of medications is recommended in the initial stage of the disease or as a supplement to other methods. Minimally invasive methods of varicose veins treatment. Modern medicine offers a variety of minimally invasive procedures that are effective for the treatment of varicose veins in later stages. Laser therapy. Laser ablation is a method that uses laser energy to close affected veins. This method does not require large incisions and long-term rehabilitation, and the effect is noticeable almost immediately. Advantages of laser therapy: minimal injury, quick rehabilitation, high efficiency. The procedure is performed on an outpatient basis, and the patient can return to normal life after a few days. However, this method is only suitable for the treatment of relatively small veins and requires a qualified specialist. Sclerotherapy. Sclerotherapy is a method of introducing a special solution, sclerosant, into the affected vein. It causes its narrowing and subsequent closure. The blood is redirected through healthy veins, and the affected ones gradually disappear. The benefits of sclerotherapy: fast execution of the procedure, minimum pain, the possibility of treating even small vascular meshes. A limitation for sclerotherapy may be the presence of large varicose veins or complications such as thrombosis. Radiofrequency ablation. Radiofrequency ablation is based on the use of radiofrequency waves to heat and close varicose veins. This is one of the most modern methods of treating varicose veins, which has high efficiency and minimal invasiveness. Advantages of radiofrequency ablation: the painlessness of the procedure, a short recovery period, the possibility of treating large varicose veins. The method is actively used as an alternative to laser therapy and sclerotherapy, especially in the treatment of large veins. Surgical methods of treatment: when varicose veins reach a severe stage and minimally invasive methods become ineffective, surgical operations are resorted to. Phlebectomy: a phlebectomy is the removal of varicose veins through small incisions in the skin. The procedure allows you to eliminate both superficial and deeper affected vessels. Advantages of phlebectomy: complete elimination of varicose veins, reducing the risk of complications. Long-lasting effect: this method is used for severe varicose veins when other methods of treatment do not give results. Rehabilitation may take several weeks, but the effect persists for many years. Transilluminative phlebectomy: this is an innovative version of the classic phlebectomy. The essence of the method is to use a special backlight to more accurately identify and remove varicose veins. Advantages: less traumatic, improved visualization of veins, reduction of the procedure time. This method is more gentle and reduces the rehabilitation time compared to classical phlebectomy. Natural methods and lifestyle changes: natural treatments and lifestyle changes can also be powerful ways to combat varicose veins. Physical activity and exercise: moderate physical activity helps to improve blood circulation and prevent the progression of varicose veins. The most useful are walking. Daily walks promote blood circulation. Swimming relieves stress on the legs and strengthens blood vessels. Yoga: certain postures help to improve blood flow from the legs. Regular exercise, especially those that strengthen the calf muscles, can significantly alleviate the symptoms of varicose veins. Diet and weight control: obesity is one of the main factors aggravating varicose veins. Weight control through a healthy diet can significantly reduce leg strain. It is recommended to include in the diet foods rich in fiber, vegetables, fruits, products containing flavonoids, citrus fruits, green tea, foods high in omega-3, fish, flaxseed oil. It is worth avoiding foods that increase cholesterol and sodium levels, as they contribute to fluid retention and poor blood circulation. Folk remedies for the treatment of varicose veins. Folk remedies used in the fight against varicose veins have gained wide popularity due to their accessibility and naturalness. Unlike medicinal methods, they most often do not cause side effects and can be useful as an adjunctive therapy, especially in the early stages of the disease. However, it should be remembered that folk methods of treating varicose veins do not replace doctors' advice and can only be effective with an integrated approach. Let's consider the most common and effective folk remedies to combat varicose veins. Apple cider vinegar is one of the most famous and widely used folk remedies for varicose veins. Its beneficial properties include improved blood circulation, reduction of puffiness, increase the tone of the skin and blood vessels. How to apply: compresses: moisten a soft cloth in apple cider vinegar and apply to the affected areas of the veins. Hold the compress for 30 to 40 minutes, lifting your legs. The procedure can be performed twice a day. Massage: rub vinegar into the skin with light circular movements in the morning and evening without rinsing it off. Internal reception: dilute 1 to 2 tablespoons of apple cider vinegar in a glass of water and take on an empty stomach. This method improves the general condition of blood vessels. It is important to use natural apple cider vinegar and not a synthetic product that can harm the skin. Horse chestnut extract: horse chestnut is considered one of the most effective remedies for varicose veins due to its phlebotonic properties. It strengthens the walls of veins, improves their tone, and prevents the formation of blood clots. The main active substance in horse chestnut is essin, which reduces vascular permeability and reduces inflammation. How to apply: tincture for internal use. 50 g of dried horse chestnut fruits, pour 0.5 liters of vodka and insist in a dark place for 2 weeks, shaking daily. Take 30 drops of tincture 3 times a day before meals. The course is 3 to 4 weeks. Ointment: you can prepare it yourself by mixing 5 tablespoons of chopped chestnut fruits with 500 milliliters of vegetable oil. It is better to use olive or coconut oil. The mixture is heated in a water bath for about an hour, then filtered. The ointment is applied to areas with varicose veins in the morning and evening. Cabbage leaves. Cabbage leaves are widely used in folk medicine to reduce inflammation and pain in varicose veins. Cabbage contains vitamins C and K, which promote tissue healing, improve blood circulation, and reduce swelling. How to apply? Compresses. Select fresh cabbage leaves, lightly pour boiling water over them, and leave for a few minutes to soften. Then put them on the affected areas, fix them with a bandage, and leave them overnight. To enhance the effect, you can lubricate the skin with a small amount of apple cider vinegar before applying the leaves. This method helps to reduce swelling and inflammation, as well as relieve the feeling of heaviness in the legs. Tomato compresses. Green tomatoes are another effective remedy for the treatment of varicose veins. They contain a large amount of lycopene, a powerful antioxidant that improves vein tone, strengthens vascular walls, and stimulates blood circulation. How to apply? Compresses. Cut green tomatoes into rings and apply to varicose veins. Fix them with a bandage or food wrap. Keep the compress for 3 to 4 hours, then replace with fresh slices of tomatoes. Repeat the procedure 2 times a day for a month. With regular use, tomato compresses help reduce the visibility of veins and reduce pain. A decoction of nettles. Nettle has powerful anti-inflammatory and tonic properties, due to which it is used to improve venous blood outflow and strengthen the walls of blood vessels. How to apply? Decoction for oral administration. 2 tablespoons of chopped nettle leaves. Pour 0.5 liters of boiling water and insist for an hour. Take 1/3 cup 3 times a day, 30 minutes before meals. The course of treatment is 2 to 3 months. Compresses. Moisten the gauze in a strong infusion of nettle and apply to the sore areas of the legs for 30 minutes. This decoction also helps fight inflammation and improves blood circulation in the legs. Garlic and lemon oil. Garlic is rich in sulfur compounds, which have anti-inflammatory and anti-varicose effects. It stimulates blood circulation and helps to eliminate stagnation of blood in the veins. How to apply? Garlic oil. Chop 4 to 5 cloves of garlic and mix with 2 tablespoons of vegetable oil, olive or coconut. Leave to infuse overnight. Use the mixture to massage the affected areas of the legs before going to bed. Then wrap the leg with cling film or bandage and leave overnight. In the morning, rinse with warm water. This method improves blood flow, relieves inflammation, and reduces the severity of varicose veins. Apples of the Antonovka variety. Traditional medicine recommends using Antonovka apples to strengthen blood vessels and improve blood composition. Antonovka contains a large amount of vitamin C and antioxidants, which have a positive effect on the walls of blood vessels and support their health. How to apply? Tincture. Take 3 large apples, pour a liter of boiling water and insist in a closed container for 4 hours. Then mash the apples directly into the infusion and take 50 milliliters each morning and evening, adding honey to taste. This infusion helps to improve the general condition of the body, improves the functioning of the cardiovascular system, and increases immunity. Important recommendations when using folk remedies. Although many of the above folk remedies can alleviate the symptoms of varicose veins, it is important to keep in mind some recommendations. An integrated approach. Folk methods will be effective only in combination with lifestyle changes, proper nutrition, and, if necessary, medical procedures. Regularity. The use of folk remedies requires long-term and regular use to achieve a sustainable effect. Consultation with a doctor. Before using any folk remedies, it is necessary to consult a doctor, especially if you are already using medications or have chronic diseases. Folk methods can help reduce the symptoms of varicose veins in the early stages, improve blood circulation, and relieve inflammation. However, in severe forms of varicose veins, they should only be used as an addition to the main treatment prescribed by a specialist. Changing daily habits. Some changes in daily life can significantly help in the fight against varicose veins and its symptoms. Avoiding standing and sitting for a long time, staying in the same position for a long time can worsen blood flow in the legs. When working sedentary, it is recommended to take short breaks for walking every 30 minutes. Lifting the legs. Lifting the legs above the level of the heart for a few minutes a day helps to improve blood flow and reduce pressure on the veins. Proper shoes. Wearing comfortable shoes with low heels reduces foot strain and helps improve blood circulation. High heels, on the contrary, can worsen the symptoms of varicose veins. Prevention of varicose veins. Prevention of varicose veins is a powerful tool for preventing the disease, especially for those who have a predisposition to its development. Weight control is a key factor in preventing varicose veins, as being overweight increases the strain on the veins. Following a healthy diet and regular physical activity can prevent the appearance of varicose veins. Proper nutrition. Proper nutrition plays an important role not only in weight control, but also in improving the overall condition of blood vessels. Foods rich in antioxidants, vitamins C and E, as well as plant flavonoids, help strengthen venous walls and improve blood circulation. Useful products: berries, blueberries, raspberries, black currants. Citrus fruits: lemons, oranges, grapefruits. Green tea. Avoiding tight clothes. Tight clothing, especially around the waist and hips, can interfere with normal blood circulation and contribute to stagnation of blood in the veins. It is recommended to wear loose, comfortable clothes that do not interfere with the movement of blood. Special exercises. Special exercises aimed at improving blood circulation and strengthening veins can help in the prevention of varicose veins. Egg. Bike. This exercise can be performed lying on your back, simulating the rotation of the pedals of a bicycle. Sock stretching. The exercise of pulling socks up and down also helps to strengthen the calf muscles and improve venous outflow. Varicose veins are a common and serious problem that requires a comprehensive approach to treatment. From compression therapy and medications to minimally invasive procedures and surgical interventions, modern methods of treating varicose veins can effectively cope with this disease. However, prevention and lifestyle changes play a key role. Maintaining a normal weight, regular physical activity, and proper nutrition can significantly reduce the risk of varicose veins and slow its progression. For those who already suffer from varicose veins, it is important not to postpone a visit to the doctor and start treatment at an early stage, when conservative methods can be most effective. In any case, modern powerful remedies for varicose veins make it possible to lead a full and active life, minimizing unpleasant symptoms and preventing the development of complications.